I often see patients at work who, unfortunately, didn't seek help in time and because of that, let their problem get worse. And you know, in medicine, the earlier you start treating something, the easier it is to manage it later. So in one case, a person keeps the ability to go to the bathroom on their own, and in another case, they have their entire intestine removed, well, their whole rectum, for example. And what makes the difference between these patients is probably knowledge, first and foremost. And that's why in this episode, I'll explain to you in what cases and for what reasons blood may appear in your stool and what you should do in such situations. So don't be afraid, we'll go through absolutely all the reasons and I'll give you simple steps on what you need to do. If you watch this video until the end, you'll never miss a serious illness. You'll always be able to understand why there's blood in your stool and what you need to do. Today, I'll talk about the 7 main causes, and for each one, I'll explain the consequence, the cause, and the mechanism of action. My mom is a doctor of science, and she is the head of the department in a hospital that deals with coloproctology, so basically she's a proctologist. And that's why I spent my whole conscious life next to my mom as a child. I saw how often and how many people came to her, and I went to work with her and saw a lot of these patients. And that's why it's very important to understand that there are a lot of pitfalls. For example, did you know there are 2 types of toilets? In one, after you go number 2, the stool remains visible. And now, very trendy toilets are the ones where the stool immediately falls into the water, and sometimes it even gets flushed automatically. Or, for example, you can't even see it, and you might think, what's the point of this nonsense? As soon as these types of toilets became less popular, our Soviet people started to examine their stool less often and began to miss the early signs. Besides, it's not always a huge amount of blood. Sometimes it's just a couple of drops and a person simply can't fully see their stool because it's already submerged and there's still more. It's often called Poseidon's kiss when stool drops and water splashes back. It's funny, but it happens. But actually, if you're interested in staying healthy, it's really important to visually inspect your stool. And then there was a day when suddenly you saw blood in your stool. Did you get scared? My friends often write to me saying, "Oh my God, help me, what happened?" There are many reasons and some are harmless. The most common reason why this can happen is an anal fissure. Why could it have happened? For example, a man doesn't need to have anal sex for this. It can happen painfully and is unpleasant. Because, for example, you ate a lot of crackers, drank little water, and had a lot of protein. The stool just became hard and you sat, strained and you just, well, simply really because of the density of the stool, your anus cracked, causing sharp pain. It's immediately noticeable. Suddenly, during the process of defecation, it became sharply painful to go to the bathroom, it hurts to wash up too, and it's very difficult to go again next time. Indeed, this especially affects people who have chronic constipation. Of course, this is not cancer, it's not that dangerous, but actually, this is a diagnosis that rarely heals on its own. It doesn't just go away because the fissure only heals and then tears again, heals and tears again, and very often, unfortunately, this fissure eventually has to be operated on. The minimum you need to do, especially if you chronically suffer from constipation, is to try to normalize your stool so that it's not hard as a rock. You can soften it, for example, by drinking more water every day and adding more fiber. To make your stool bulkier and softer, use some local remedies that will help soften it. Maybe Microlax, maybe some enemas, sometimes some special relaxing ointments. If the situation is really severe, when everything is so tight, sometimes they even inject Botox. That's why it's important to remember that if you suddenly see blood, most often on the toilet paper, and it was painful, most likely it's a fissure. Of course, it's not life-threatening, but unfortunately, it's a direct path to a very uncomfortable experience in the bathroom. And believe me, because of these fissures, the sphincter often starts to contract, and then people begin to suffer a lot. Friends, there's a link under this video to my free Telegram channel where I personally share my experience, life hacks, and interesting insights from scientific articles every day. You will be aware of everything happening in the world, you'll receive a huge amount of information, and you'll become better, and the best version of yourself. The link is under this video. Click it, go there, and subscribe. The second most common reason, you probably already guessed, is hemorrhoids. Hemorrhoids, you won't be able to ignore them either, especially if they flare up. What is hemorrhoids? In simple terms, you've seen, for example, varicose veins on the legs. Now imagine that around the rectum, on the rectum itself, there are similar veins. and sometimes they can get thrombosed, meaning a blood clot forms there. This venous complex gets blocked, it can burst, and blood can start flowing from it. And really, most often it's also on the paper, but if in the first case the blood is usually bright red arterial, in this case it's usually darker. And this blood appears on the surface of the stool. It shows up on the paper when you wipe yourself, so if it stays on the paper, it means the source of the bleeding is your anus. That's why drops can happen. You went to the bathroom, everything was fine, then it started dripping, a node burst and blood started flowing. This usually results from straining, a sedentary job, or chronic constipation. If you're a taxi driver, it's usually a weakness of the venous wall from all sides, which adds up. And hemorrhoids, of course, are considered a dangerous disease, but the tricky part is that under the guise of hemorrhoids, people blame any kind of bleeding on it for years, until it turns out that, in fact, the source wasn't in the veins at all. We always want to believe in the best and think, oh, it's just hemorrhoids, but in reality the cause might be something else. And even hemorrhoids themselves, believe me, can be serious. With bleeding like that, people might not even make it to the hospital. And very often, when a person is chronically losing blood, their hemoglobin is very low, their iron is low, meaning there is constant ongoing blood loss. What should you do? First, stop diagnosing yourself with hemorrhoids and just sitting at home. A proctologist hasn't examined you, there was no colonoscopy, no anoscopy, so don't diagnose yourself. But at least you've calmed down, you found out it's hemorrhoids, so go see a proctologist, most of the time. What kind of treatment? Is this the treatment? Suppositories are venotonics, the same ones you use when you have varicose veins in your legs. It's about making your stool softer than this table, not as hard. And in some cases, ligation of the nodes is used. There are different techniques. The nodes are stitched, operated on, or there are methods where they are burned with a laser to make them shrink. In fact, you could say it's very similar to how these same veins are treated on the legs. This is actually an important thing because 30 people who are sure they have hemorrhoids are actually mistaken, and it's not hemorrhoids. Imagine every third person self-diagnoses, often after watching videos like this, assumes it's hemorrhoids and just ignores it since it's not painful or too uncomfortable. So, why see a doctor? Hey friends. The third thing is polyps, intestinal polyps. A polyp, imagine, is a small growth, not really like a wart, maybe of different shapes. Sometimes it grows like a small coral, which is located on the inner surface of your intestine, on the mucous membrane side, and you can't feel it. They are absolutely painless, so if you have a polyp in your intestine, there could be 5, 6, or 7 of them, and you wouldn't know. And there are benign polyps and malignant ones. Benign polyps can turn into malignant ones, meaning they can grow in size, they can become inflamed, they can turn into malignant forms, and they definitely do not cause any discomfort. You can use the bathroom daily, have polyps without feeling them, they grow unnoticed and may occasionally cause minor bleeding. And it's so subtle that a person doesn't notice it. But that's exactly why polyps are the main, I would say, precancerous form. It's the stage where cancer hasn't happened yet, but it can appear. That's why during a colonoscopy they check the lumen and identify polyps as normal or malignant. They perform a biopsy, find cancer, and remove that section of intestine and the polyp. The only way to understand what kind of polyp it is, as you already know, is during the procedure, meaning to have the procedure done in time before the polyp grows so large that it becomes obstructive. Because it became cancer, the passage is blocked, so you can't use the bathroom. That's why removing a polyp in time most often prevents cancer, especially if it's a polyp with already impaired differentiation. Most cancers usually start with a polyp or mucosal dysplasia. That's why a colonoscopy, which all doctors recommend you have every few years, not after 15 years of course, but once you turn 40, is absolutely necessary. The fourth reason is inflammatory bowel diseases, the most common being ulcerative colitis and Crohn's disease. In these cases, blood can actually mix with the stool, it may have a mucus character, and it can be accompanied by pain, bloating, false urges, you may lose weight, have unusual reactions to food, there may be anemia or some fatigue that usually doesn't have any clear cause. Many believe this is just irritable bowel syndrome, but it's actually caused by serious autoimmune processes and is very hard to treat. It can only be put into remission. Most often, the intestines become inflamed, sometimes to such an extent that the blood vessels in the intestines are damaged, which leads to the fact that you may actually see blood in your stool. What should you do if you suspect you have this condition? The first thing is a stool test for calprotectin. The second is a complete blood count to check for chronic blood loss and also to check iron, ferritin, and C-reactive protein. I'd likely get inflammation tests, then a colonoscopy, especially since it's now free. A gastroenterologist treats this, likely prescribing anti-inflammatories along with a coloproctologist. You can also see him to get a diet plan depending on what is found in your intestines during the colonoscopy. The earlier the diagnosis is made, the lower the risk of complications and intensive treatment. I've seen people who went from being professional athletes to becoming severely disabled because they ignored the problem for too long. I even have a friend who's a doctor and he consults many famous athletes, but he himself suffers from this condition. Reason number 5 is an intestinal infection. Yes, indeed, an intestinal infection is also a common reason why blood may appear along with diarrhea, nausea, pain, and high fever. If this happens frequently, it's infectious colitis. Which pathogens most often can cause infectious colitis? These are Salmonella, Shigella, Campylobacter, E. coli, and there are also viruses. And that's why if you happen to eat a sandwich somewhere with stale mayonnaise, Salmonella really likes to hide in such foods. You can actually get a complication where you go to the bathroom in the morning with painful bloating and see blood. What should you do in that case? Stool tests for pathogens include polymerase chain reaction and infection panel, and sometimes a bacterial culture. Treatment depends on the pathogen found. Unfortunately, there's no single medication that kills them all. It's absolutely individual. After you identify the specific pathogen that's causing your issue, they'll tell us to take this antibiotic, which will kill the pathogen. Once it's gone, the immune system stops attacking, your intestinal wall is safe, the bacteria leave, and that's it. It'll be okay. But often you eat something bad, get food poisoning, and see blood in your stool. And you think, maybe it's inflammation, maybe I need this antibiotic. 7. And if you don't target the right bacteria, if you don't match the sensitivity, you can make your condition even worse. 6. The cause is ischemic colitis, and that's a condition that, honestly, I would definitely not recommend ignoring, not even for a minute. Because in older people, especially if they have vascular problems, for example, with a sudden drop in blood pressure or when taking certain medications, there can be a disruption of blood supply to the intestines and blood in the stool. This is a very dangerous sign. It's one of the very first signs, and it is often accompanied by sudden pain. It's a sharp, unpleasant stabbing pain in the abdomen, weakness, a sudden deterioration in well-being, and a drop in blood pressure. All of this may indicate that there is a large amount of blood loss. What should you do in this case? I would recommend calling Sculptony RU. That much of the intestine is dying. Sometimes we perform surgeries involving risks, like creating a reservoir from an intestinal segment. Occasionally, this segment can encounter issues. I've encountered cases in my practice where this reservoir doesn't survive. It gets thrombosed, meaning thrombosis occurs for various reasons. These are normal post-operative risks. When raspberry jelly appears, it's clearly not viable. It likely needs to be removed. Ischemic colitis is a serious, potentially life-threatening condition. Here, time is likely the key factor to pursue. That's the 7th reason. I made this one last on purpose, not because it happens the least often. It's just that when you hear the diagnosis cancer, you immediately close the video. This isn't about me. It will happen to someone else, but we need to discuss it. It's a reason nobody wants to think about, but one that can't be ruled out. And you know that intestinal adenocarcinoma is also one of the top causes. As a cause of death, it's the stomach and intestines. That's why all doctors say to get a colonoscopy, get a gastroscopy, and the blood can really be dark. That's a feature because it mixes with the stool and can be very scant. It can appear and disappear. That is, everyone thinks that as soon as a small growth appears, it immediately starts bleeding everywhere. No, that's not the case. There are patients who come to us who never had any blood in their stool, and they just have a problem with defecation. The stool can't pass through the lumen anymore. Many assume cancer is always painful, but that's a misconception, like thinking kidney cancer always bleeds. It may give just one clue. A modest, sometimes occasional admixture of blood in the stool. This is your opportunity to get help in time. You have two choices. Either get scared and hope it doesn't happen again, and maybe it won't until stage 4. The second option is to get examined. What should you do? You must get a colonoscopy. No other test, ultrasound or X-ray can substitute it. Many men avoid colonoscopies out of fear or embarrassment, seeing them as shameful or humiliating. It's necessary and should be done when needed. If visual examination finds any polyps, especially unusual ones, or a growth narrowing the lumen, a biopsy should be done. Colon cancer is one of the most well-studied cancers. If it's detected at an early stage, we can help you, we can cure you, and you'll be a healthy person without suffering. So don't be afraid. If you see blood in your stool, recall this video, consider what it could mean, and act promptly to avoid wasting time. What needs to be done? Let's imagine you went to the bathroom and saw blood. The first mistake is to ignore it, dismiss it as unrelated, or blame it on something I ate. First, you need to immediately assess the nature of the blood. If it's scarlet, bright, and as we've already discussed, it stays on the paper. This could be a fissure, which is usually darker, or more often hemorrhoids, but usually if it's bright red on the paper, it's most often hemorrhoids, especially if it hurts, or a fissure. If the blood comes with mucus, it's most likely inflammation. If it's dark and mixed, the source is the large intestine. If it's almost black, like coffee grounds, that means it has had time to be digested, and the source is the upper part of the stomach. Yes, that's why we need both a colonoscopy and a gastroscopy. A common mistake is seeing dark blood, getting a colonoscopy, and assuming everything is fine, it was probably just something I ate. They often overlook the stomach, even though the cause could be an ulcer or stomach cancer. So if you see something that looks like coffee grounds, altered liquid, or digested blood, you definitely need to check the upper part. It happened. Yes, that's all. Do you have an idea what the cause is? For the next 24 hours, we must reduce anything that hinders doctors from assessing. First of all, definitely avoid foods that change the color of stool, like beets, so don't eat blueberries, activated charcoal, remove all of that. We also stop taking NSAIDs, because if you have a source of bleeding, like an ulcer, and you keep taking NSAIDs, you'll increase the risk of even more severe bleeding. Third, tests are essential. You need to get tests, including a complete blood count, to determine how long this has been happening. Because with a complete blood count, we can actually suspect whether it's a fresh bleed or chronic blood loss. Second, rule out inflammation from iron stores, including ferritin and C-reactive protein. Take a fecal occult blood test. Sometimes there are people who don't want to do a colonoscopy, so they can do a fecal occult blood test instead. This is an immunochemical test. It will show if there is blood in the stool, even if you can't see it with the naked eye. Then you go for a colonoscopy and calprotectin test, which will show inflammation. We discussed it today. Do you need an ultrasound? Yes, in some cases you need to do an ultrasound of the abdominal cavity and pelvis because ultrasound does not make a diagnosis. Every ultrasound form states at the bottom that it's not a diagnosis and needs interpretation by the attending physician, but it helps rule out or confirm some conditions. Because if there is a large tumor in the intestine, you can always see it on ultrasound. This is also very important if it's not a one-time occurrence, if you're not sure, and even if you think it's just a fissure. I still recommend a colonoscopy per guidelines. I don't like suggesting them, but sometimes they're necessary. It's really an unpleasant but very important and serious examination method, and it gives answers to 95 questions and resolves all these worrying conditions for you. Because it's much more harmful for the body to guess, to take risks, to hope that maybe you'll get lucky, but that's not for me. It's easier to just go and get a colonoscopy when you really need to drop everything and seek help. Severe bleeding, especially with intense pain, that's the first scenario. The second is when there's blood plus weakness plus cold sweat. Why? Significant blood loss can occur internally with up to 1.5 liters in the intestines before it's visible outside. It has clotted, it's just sitting there. And a drop in blood pressure, weakness, cold sweat, these are signs that there might be severe bleeding, maybe an ulcer. If there's blood and also a fever, that's not good either. It means there's active inflammation. You need intervention. You can't treat this at home anymore. Blood and vomiting that looks like coffee grounds could mean an ulcer, a bleeding ulcer. If the blood is dark, almost brown, you also need to see a doctor immediately. If you are 50 or older, that means you are immediately in the risk zone. Having blood in your stool at 20 is very different from having it at 50. These are entirely separate risk groups, and here you already have a chance of having a malignant tumor. You should also see a doctor right away, and everyone who has a sudden significant weight loss without any reason over a few months must definitely get checked. A patient says, over 3 to 4 months I lost 15 kilograms without changing my eating habits, the weight just disappeared. Everyone should go to the doctor without waiting for something to start hurting. And of course, if the doctor finds polyps, talk to a specialist, recommend it to him, and say that you agree to have them removed right away. This is the most important prevention of colon cancer. The most important thing is a polyp that is detected and removed in time. Blood in the stool is definitely a reason to think about it. It's foolish to deny that. You shouldn't panic, but remember this video and consider in which case, which specialist you need to see, what needs to be done, and when. I shouldn't delay. If you keep this video in the back of your mind, believe me, it might one day save your life or the life of someone around you to whom you can give advice. Thank you for watching to the end, and stay healthy.